What is a stroke? A stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. A stroke is a medical emergency. Early action can minimize brain damage and potential complications. Next, coming down to symptoms. What are the symptoms? First is trouble with speaking and understanding. You may experience confusion. You may slur your words or have difficulty understanding speech. Second is paralysis or numbness of the face, arm, or leg. You may develop sudden numbness or weakness or paralysis in your face, arm, or leg. This often happens just on one side of your body. Try to raise both your arms over your head at the same time. If one arm begins to fall, you may be having a stroke. Also, one side of your mouth may droop when you try to smile. Third is trouble with seeing in one or both eyes. You may suddenly have a blurred or blackened vision in one or both eyes, or you may see double. Fourth is headache. A sudden severe headache which may be accompanied by vomiting, dizziness, or altered consciousness may indicate you are having a stroke. Next is trouble with walking. You may stumble or experience sudden dizziness, loss of balance, or loss of coordination. Next, coming to the causes. A stroke may be caused by a blocked artery, that is ischemic stroke, or the leaking or bursting of your blood vessel, that is hemorrhagic stroke. Some people may experience only a temporary disruption of blood flow to the brain, this transient ischemic attack or TIA that doesn't cause permanent damage. Now, what is ischemic stroke? About 80% of strokes are ischemic strokes. Ischemic strokes occurs when the arteries of your brain become narrowed or blocked, causing severely reduced blood flow, ischemia. Next is hemorrhagic stroke. Hemorrhagic stroke occurs when blood vessel in your brain leaks or ruptures. Brain hemorrhages can result from many conditions that affect your blood vessels. These include uncontrolled high blood pressure, hypertension, overtreatment with anticoagulants, blood thinners, weak spots in your blood vessel walls, aneurysms. A less common cause of hemorrhage is the rupture of an abdominal tangle of the thin walled blood vessels, arteriovenous malformation. The most common ischemic strokes include thrombotic stroke. A thrombotic stroke occurs when the blood clot thrombus forms in one of the arteries that supply blood to your brain. A clot may be caused by fatty deposits, plaque that build up in arteries and cause reduced blood flow, atherosclerosis or other artery. Then another one is embolic stroke. An embolic stroke occurs when a blood clot or other debris forms away from your brain, commonly in your heart, and is swept through your bloodstream to lodge in narrower brain arteries. This type of blood clot is also known as embolus. The types of hemorrhagic stroke include intracerebral hemorrhage. In an intracerebral hemorrhage, a blood vessel in the brain bursts and spills into the surrounding brain tissue, damaging brain cells. Brain cells beyond the leak are deprived of blood and are also damaged. High blood pressure, trauma, vascular malformations, use of blood thinning medications, and other conditions may cause intracerebral hemorrhage. Next is subarachnoid hemorrhage. In subarachnoid hemorrhage, an artery on or near the surface of your brain bursts and spills into the space between the surface of your brain and your skull. The bleeding is often signaled by sudden or severe headache, commonly caused by the bursting of a small sac-shaped or berry-shaped aneurysm. After the hemorrhage, the blood vessels in your brain may widen and narrow erratically, vasospasm, causing brain cell to damage by further limiting blood flow. If you have any doubts or queries, I request you to write down in the below mentioned comment box. If you like this video, kindly click on the like button and don't forget to subscribe to this channel. Thank you and have a nice day. Bye.